of course, it starts to load up. I don't know, why is the screen like that? But anyway, so of course, what are you gonna do it for? Come on, that's something. Um, you're gonna do it for either adult, neonatal, or pediatric. So of course, if I'm gonna do an adult, I just choose the adult, right? So okay, adult. So it tells you and it guides you through. Type the first two letters of the drug name that you're going to infuse to your patient, right? So whatever. So for example, someone tell me a drug. Heparin. Everyone knows heparin, right? H. Okay, so there goes heparin. It pops up. And these pumps are programmed with all kinds of the names of the medication. So whatever you just type in, it pops up. So heparin. So I'll press OK, and it gives me actually the whole sets. So for example, dose units per hour. You have to know that. Most pharmacists, they will give you those numbers, but you have to know how to calculate. So this is why we all have MediCalculation. So that's why that comes in, right? So of course you'll put the numbers in. So whatever rate it should be going in as, you just plug it in. You plug in whatever the doctor's order say, or the pharmacist's order is for you to put in from the MAR. Okay. Once you do that, as soon as you put in all your information, I'll just do something. For example, I'll just put any number. Okay. Rate. I'm not gonna do 10 mLs. Maybe like. Actually, let me go back up. Dose units.
Dose one.
Below lower hard limit, enter a value of 100 or higher. Okay, so we'll do that. 100. Okay, below limit. Okay, so we'll try another medication. Okay, for example, I'll clear the program. So whenever you want to start a new medication, always clear program, and then it starts back in the first thing. So I'm gonna do vancomycin. Everyone knows vancomycin, right? That's one of the most common ones. So here's vancomycin. Vancomycin is there, and it gives you the different rates that it could be ordered as. Can you see? Come over.
Do we need to do this to get performance?
No,
right?
I'm just showing you because you will have to know this, I think, for advanced medicine show. But just so you know, when you go to the hospitals and you see the nurse showing you as well, then you already have an idea. So I'll just choose the first one, for example, if that was ordered, right? So yes. And then now all you have to do is connect your tubing, and then as you connect it in, because it's telling you to actually choose either primary or secondary. So if you're gonna hang it as a primary bag and then it's done and you discard it, then you'll choose primary. If you're gonna hang it as a secondary because you already have a primary bag hanging, as you saw in the video, then you'll do it as a secondary. Okay, and I'll show you. All right, so that's that part in terms of the pump. All right. So of course,
I have a quick question. The pump only has one connection. Let's say, for instance, you have two of them, like the primary and the secondary. For the pump, how do you set it up? Like
you can do it in the same connection. That's why it's called secondary, because you connect your secondary line to your primary line. I'll show you.
Okay.
Professor, can you mention what are the supplies that we need?
So all of the supplies that you're going to need is a primary infusion bag, which is, as you see here, it could be normal saline, half normal saline, dextrose, whatever is ordered by your doctor. Okay, so you have this here. It normally has this little hole here where you can actually, where you can actually hang it up. Hold on.
So you need to gather the supplies first.
Of course, you will have the supplies prepared for you when it's time for your performance. All you have to do is just know how to put it together. Okay.
Okay.
Also, you have a primary tubing. It normally tells you on here what kind of tubing it is. So continue flow solution set. For this specific pump, every pump has a different type of tubing. So as you can see, this thing here, and I'll show you how it works within. It goes into this tab here. But the primary line always is longer than the secondary. That's how you know the differences between the two. Okay. As you can see here, I'll show you the secondary. So you also need a secondary line for the secondary bag, right? It's gonna be because I'm not using it. So you just that's okay. That's
for the primary feature. We need a secondary line.
No. For the primary, okay. I'll start over. So primary. Okay. You have your bag.
Okay.
Your primary tubing.
Okay.
So and that's it.
Okay.
This is only for your primary.
Okay.
But I'm gonna show you now when you're gonna do your secondary. You're gonna need your secondary bag and your secondary line.
Okay.
Whenever you have a secondary line, it always comes with this blue hanging thing here.
Yeah, to lower the
To
primary.
lower.
Because why? You have to put the primary now lower than the secondary. Why is that? Because it goes by gravity. So whatever is higher infuses first. When it's finished, your pump knows to continue with this. But you have to program it that way. Right? Okay. But I'll show you. So for now, I'm gonna forget about secondary. I'm gonna leave it here.
Yeah.
Okay. So I don't confuse you. I just wanted to show you. Okay. So I'll leave that here. We're not gonna worry about that. Of course, on my hands, on gloves. Let me see if we have
We need a flash too? I see a flash
well,
there.
you have a flush if you need to flush your patient. Yes. Because before you actually connect the line to your patient, you have to make sure that the IV is working. Because if you just connect the line and you don't check and it's not working, then you can cause an infiltration to your patient. Okay. All right. So this is the steps. All right. So you have this hanging here, right? So you have an order to infuse your patient with vancomycin 1500 milligrams, right? So all you do, pretty simple, right? It comes with this little tab here, paper tab. You just take it out. It's just to protect it, keep it in the actual bag. Okay. So I was telling you guys that you can use actually the bag as well. So what I do, I just put it in here like this. It's gonna keep it. You put it in here like this. Let me just turn it off. You put it in here like this, and then you can prime it. So that's when it's connected. So I'll show you how it's done. Okay. So this gets connected to where? Where do you guys think?
The red one.
The red one, because there's always two. This is gonna be for medication. They use a needle-filled syringe to instill the medication inside. That's what pharmacy does. But the other one, I'll show you here. You just pull this out, and this is for you to, to spike it. All right. So I'll leave it like that. I touch it. All you do is take this part out, right? You hold it like this, and then you spike it. As you see, I did it on purpose so you can see.
You didn't clamp.
Exactly. If you don't clamp it, what's gonna happen? You're gonna build air. Look how air bubbles are in here, right? And that's you're losing medication or fluids. So first, before you actually spike it, you have to clamp it. Okay, it gives you more control as well. The chamber is already filled to the half, so that's fine. You don't have to press it anymore. So since now it's already,
So before you spike it, you need to
clamp it.
Clamp it.
Yeah. So you hang your bag, you take out the line, you clamp it, and then you spike it. Okay. Once you do that, you can if you want to, you can take off the tip or you can leave it. I like to leave it on. Is more protection, right? It doesn't hurt. Okay. So now you can see it with the dripping, and you have to watch the line because you have to make sure that all of the air bubbles are now out. So now you can go ahead and continue. Okay, you see it dripping, right? Okay, and watch. The lower you go, the faster it is, and the higher it is, the slower.
Yeah.
Okay, so y'all see how it's coming, right?
So, like in simple words, like for me to get it right, to priming means to get all the fluid running and no air bubbles inside the.
Yes,
That's
correct.
the priming.
You're priming the line.
Okay.
Yeah, you have to prime the line because if you spike it and then there's air in here, and then you connect to your patient and then you start the infusion, that means it's nothing but air going in your patient first and then the fluid, and that can kill your patient. It's called air embolism. Okay, and that's not good, right? So
Even though the tube is like kind of.
yeah, it's okay. But as long as you can see what's going on here, it's fine. Yeah. So do we see any more air bubbles?
Yes.
If it's this small, there's no worries. This is not gonna kill the patient. But I will tell you, if you see anything like this, definitely flush it out. You see it? Yeah. Okay.
So you can only get rid of them like flushing, or you can like leave tap a little bit or no?
Even if you tap it, it's
It's
still
not gonna
gonna be
go.
there because it has to come out. Yeah,
Okay.
it has to come out.
Let's say, for instance, okay, the way you're doing it right now, you're
Mhm.
kind of losing fluid, you know. So let's say, for instance, the patient was ordered to get all the whole bag, you know. Yeah, now you're losing fluid.
Exactly. So, but I was showing you because the way I did it, I spiked
Yeah.
it without clamping
Clamp
it.
it.
So to prevent that, to save more on fluid, you clamp it and then you spike, and then you press the chamber, fill it first before you actually open it, and then that will prevent you from having air bubbles. But that's only because you see all of that because I didn't clamp it.
There's another big one here, right?
Let me see. Where is it? Okay.
Right in the middle.
This is fine. This is not a problem.
This one, just to learn, like I don't want
No,
to.
I know. So, but for test purposes, just make sure you know no air bubbles, okay? This is pretty much not gonna hurt your patient unless if you see the one that I showed you before, okay? You just have to make sure that that's clear. Okay.
It's coming.
It's dripping, that I do know. Yeah, so this is fine. It's okay. So, but just make sure for test purposes that no air bubbles, right? So in this case, what do you think is the next step?
You have to put it into pump.
Okay, so this is why we have to have the pump, right? So you put it in the pump. This is the blue tab that you can actually use to actually install it into the pump itself. All right, so you bring it all the way up here. How are you? You bring it into the pump. Okay, so now we have to restart it again. So adult vancomycin, because sometimes it saves it, but sometimes it doesn't. So same thing. All right, so it's there. Is this the dose? Because it asks you to confirm. Is this the actual dose? Just to make sure? Yes. And you say yes. Okay, perfect. So now you're ready. All you do, you take this, the smaller tip first, right? And you just, and it opens the door for you, right? And you leave it there. There's gonna be check marks, 1, 2, 3, check marks. All you do is you use your finger and you push it in, and you just bring it in, and it will check it off for you if everything is clear.
Wow.
Everything is clear. So now what you can do is close the door. You open the door, now you have to close it, right? All you do is now lift this part up because if you don't do so, it will beep. All right, and that's it.
So,
go ahead.
sorry,
Go
when
ahead.
you insert it, that is just to make sure that everything is working fine.
No.
No.
This helps to connect it into the actual.
That's the only function.
Yeah.
Just to connect it.
It's a function that actually helps to and put this in here, open the door for you,
Open the door.
and then you
Okay.
actually just align it down the line, right in the middle.
Okay.
I'll show you again. Okay.
What does it do when you
Okay.
align it
But
inside?
during the performance, we need to turn it on and set anything, any medication, no, right? Just to insert the tube.
Yeah, that's it.
Okay.
Yeah. So you insert it, right?
Open it.
You see, you have to just go down in the middle. It just tells me the door is open, but I may have to redo it. Let me see what it says. Okay, yeah, I'm gonna have to. Well, actually, it's fine. Okay, all right. So you take that out because if you leave it in there, what happens when it's in there? It's like this, so it's clamped. So you have to take it out. All right. So now you're ready. That's all it is. You're ready, and then you unclamp it here, of course, right? Once you unclamp it, it's not gonna leak because it's clamped. Okay, it's in here. It's clamped. Okay, only the pump has full control now. The pump actually is programmed to give how many fluids that it's supposed to give. So now it tells you this is what it's gonna do. It's gonna go at a rate of 167. Okay, mLs per hour, and the IV, of course, if it's 1 liter bag, you have to program it because it says VTDI is volume to be infused. So that means how much volume is in the bag that you're trying to infuse into your patient. So for example, if this is 1,000 ml, I would change it here to 1,000 ml because it's not a 250 ml bag, right? But it's just for an example to show you, okay? Because this is programmed for a 250 ml bag at that rate, all right? And this does it for you. You don't have to calculate it. But You learn in school that you have to do Med-Cal, right? So,
Mhm.
but anyway, so that's that. That's it.
Professor, what you just did is according to the steps from the book.
No, I'm just showing you this. But in terms of priming the line, because we're testing on priming, only the priming. I'm just showing you what comes along with it.
Yeah.
So you
Okay.
know.
Okay.
Thank you.
Only thing you're testing on is priming the line. That's it.
We don't have to put in the pump when we come here on next Monday.
Nothing.
Prime.
Okay,
Prime.
just so you know her.
Please. Don't confuse yourself. I'm just doing these extra steps just to give you more than what you're paying for. That's it. I'm just trying to help you. All right.
Thank you.
But only priming the line, making sure that there is no air bubbles, and you know how to prime it. You can use a trash can. Well, I don't like trash can because I think the trash can is dirty. I just don't like trash cans. Even though that you're hanging it above it, when you're entering the fluid, there's I don't like it. But anyhow, you can use that, gloves,
Do we
etc.
need the label?
Huh?
The label.
tape? Yeah, the label.
So label the
I have to
We
label.
don't have no. You
No,
can
we
just
don't.
specify that you'll have to label
Verbalize
it, but they don't have labels there, so I can't really
And
tell
it
you how
will
to
be
put the labels.
around at the bottom of the chamber, right? We put the label on the top.
You can. Most people, what they do, you can put it anywhere that you want to. Most people put it up here, but never put it here because why? How are you gonna see what's dripping? Yeah, you can put it here. Yeah, below, and then you also label the bag. Before you hang any medication, you always have to check expiration date. So you have as here the lot number and expiration date, because sometimes most charting system asks you to put that in to chart that. Okay, just so it's not expired, that you're not giving anything expired. Okay, because that can kill your patient, and that's it.
The
Alright.
label you can see it is the same one that will be here.
No, it's a different label. Normally the bags have this squared label where you can put the name of the fluid that's in here, and also put the rate, the date that it was put up, the time, etc., and your initials. This one has the ones that you saw in the screen that has the little rectangle thing that you put here, and that's it.
And
Yeah.
what information is the one that was here?
You would put your the date it was started, date, time, and your initials. Okay, just so they know what
So the
date to change it and the time to change
Yeah,
it.
the different now are above is the medication, the rate, the date and time, and here is my
Yeah.
information.
You'll see it when it comes. So when you have it, most facilities they'll give it to you. It's provided to you. It's just the school that doesn't even have it. So if they did, I would show you how it looks like.
Professor, to
One
grab it,
second.
to
I'm
grab it,
sorry, go ahead.
the Y wheel goes down or up?
To clamp it,
Uh-huh.
this right here.
I have a quick question.
Like this.
I just
Oh,
see in the
okay.
book that they actually prime it before they do the IV line first.
Yeah. Well, that's the book. You have to have a line prior to even starting the medication. Why do you think so? Tell me.
Taking less time, I guess.
No.
Decrease the risk of contamination.
No.
So now it's clamped?
Because why? What if you have a patient who has an order for blood transfusion, right? And it tells you you have to hang the blood for 30 in 30 minutes. If you don't hang the blood in 30 minutes, you have to return it. So so now you come to your patient.
You're gonna have
And
to do
then
the
so
IV
they have
line.
the line.
Oh
It
my
takes more
gosh, I can't
time.
find the line. Everyone is trying. Nobody can find the line. Now it's 45 minutes later, and you still have the blood.
So you
What's gonna
can use
happen?
that.
You have to
You have to
You
return
have
the
to
blood.
return the blood, and that's an incident report. So this is why you have to make sure your patient has a line before you do anything. And also why, if for some reason they just code, you already have a line, and we give emergency their meds quick, and they're good, right? So always make sure that they have their line before anything.
One more question. I'm sorry.
Go ahead.
So they can't have a line without having nothing going inside the line.
Correct.
Okay.
Every patient in the hospital has to have a line, even if they're just there for something basic, right? Because why? Sometimes patients pass out, or they fall, or they code. When they code, they already have a line. Okay, give them this medication, and then they're good. You don't have to be trying to look for a line, and then you're wasting time trying to save a patient, right? Every patient has to have a line. All
I'm
right.
so sorry for this question.
What?
Now it's on or it's off, the clamp?
It's locked. You see? Okay. When it's farthest away, it's open. You see?
Oh, it's open.
When it's towards the actual smallest section, it clamps it.
Oh, okay.
Yeah. You can see it through here. How it clamps
Oh,
it.
okay.
Yeah. You want to try it? I think if you feel it, then you'll kind of understand how it works.
Professor,
Yes.
when you connect the Lura lock, do you have to wipe it with alcohol?
Yes. Before you connect to your patient, you have to If it's fresh from the bag, if it's like this, you don't have to do that to this. But on your patient, you have to clean it. You have to sanitize their port.
Is that part of the test?
No,
No, she's
you don't
just
have to connect your patient. This is priming the
Just
bag.
Just fine.
Yeah, priming. That's it. Priming. But when you have to, I have to keep repeating. So when you have to connect the line to your patient, you have to clean it, sanitize it, and then you connect your patient. Because this thing is all over the place. So,
But like, there are
20
some
minutes.
caps that already
5
have alcohol.
there are caps, and again, they don't even have them here. There are caps. They do have these caps that some nurses hang on the poles that they can actually take and twist onto the caps so that it's already clean. So if it's there, then you don't have to use the alcohol swab. It's fine. Just connect it. That's it. All right. So now we've already done primary bag priming, right? So now we're gonna do our secondary line. Secondary line comes with, of course, you have to have your secondary fluid, right? And then you have your what? Your line. Make sure it's clamped. All right, and this is how you clamp it. All right, so now you're ready. You check your orders, did your 6 rides, okay, right patient, right dose, everything. You came in, you washed your hands, everything, and everything is to the T, right? All you do is get another section, put your bag, right? Of course, you've already checked your expiration date, etc. So now, what you can do, you can actually take this. Oh, I was gonna ask a question. Okay, so of course the primary bag goes lower, right? You already know that. You take that, you put this through here.
It has to be done before, or we can do it after.
Either way, before or after, it doesn't really change the trajectory of what you're doing. Either way. If you want to do this first and then you put this lower, that's fine, okay. That's fine as well.
If we don't hang it in the correct order, what happens?
That's not a problem. As long as you do it.
No, if we do not hang it in the correct order, what
Like I
happens?
say, for instance, both
Yeah,
of
but you
them.
forgot of this
There's
gluten.
no correct order.
Okay.
Let's say, for instance, both of them are the same height.
Alright, maybe you
Oh,
don't put
okay.
this.
Okay, so what's gonna happen? Your pump's gonna be confused as to what's supposed to be infusing. So what's gonna be going? Your primary might still be the only one going, and your secondary med might not go.
What, so I could infuse at the wrong rate also, the wrong medication?
That's true too, because it's not programmed. Well, I mean, it could be programmed in the computer, but it's like it's trying to figure out which one is primary and secondary. So you have to really have it go by gravity. Yeah. So it's not gonna pick up the right medication, or it might do both together at the same time. But you don't want that. Okay. To prevent that, so we do it this way. All right. So it's clamped, right? So of course we know that we have to remove this one. Oh.
Yeah.
Oh, I see why. Because they use this one already.
Oh.
They already punctured it. You see, it's punctured already. It's not supposed to do that. If you see that happens, that means they probably already used it. It's already punctured. I mean, it's for practice reasons. I guess they were just trying to save. Okay, there is another way that you can also prime it as well too. I normally do it this way too. You'll find some nurses do it, and as you saw in the video, they use it. They go like that. So we can just go like this too.
Okay.
I like to do it this way too. Just hang it and then stack it like that. It makes it easier, less weight in my hands, and that's okay, right? So it's already clamped. So now I can turn it around. As you see, there's nothing in the chamber yet. So what I can do, I can squeeze it. Okay, and that allows for less waste. All right. So what I can do now, I already had to use this one already. So now I'm going to prime it. Yeah. So I'm gonna slowly open it and make sure that you're watching it, because you don't want to waste medication. You can go slowly. You don't have to open it all the way, because if you do so, then it'll go extremely fast and you'll waste medication. Yeah. Okay, and that's it. I clamp it. It's fine.
It's fine. Yes. No.
Fine. It's
Yes.
fine.
It's fine.
Yes.
Yeah.
So if you do it like that, you're not gonna get any air bubbles.
Yeah.
No, no, there's
No
no,
air
there's
bubbles.
no,
Just
No
make sure
air
you close
bubbles.
There's
this
no.
before
There
you
should
do
not
that.
be any air bubbles.
no, no, it's not
no
there.
air bubble.
It's just the water.
Yes.
You know, but no air
No air
bubbles.
bubbles.
That's
Yes.
it. Isn't that the easiest thing?
Yes, it
And
is.
that's why I told you, don't mind the video. It's the easiest thing. All you do is the same thing you do for this one. You hang it, you stick it, well, spike it, and then you prime it, and then you clamp it. And
Are we
that's
going
it.
to collect it with
After
the
you-
primer?
Yes. So after you're done with that,
Okay.
right?
Yeah.
How do we connect it to the primary, right? So this is what you're gonna have to know as well, because you have to do secondary line, right? I like to just hang this up here to get it out the way. All right, so this is the primary line. Where do you think I hang it?
And the little thing connection
the
to
port.
the first one. To the first primary.
This
primary,
one here?
yeah.
The closer to the pump they see in the video.
You have to hang it above the pump.
Oh.
Why? Because if you hang it here, the pump is not gonna know that the primary is connected, and and it won't actually, how do you say it? I'm trying to find the right term. So if you connect it here, that means it's free flowing on its own, and the pump is. It's not, though it's programmed,
Regulating.
it's not going to be infusing as the pump is programmed, okay? Because it's going to be going by free flow, all right?
This one goes straight directly to
Correct.
the.
This is closest to the patient.
Yeah.
So this is connected to your patient, and this is the one that's to your patient. So this is right here. So this is that. All right. So I mean, if you connect it here, it's just gonna free flow, and your patient could possibly die. So you have to do it to where the pump can sense it, and it's going by what's programmed in the computer, in the pump, right? So of course you clean here because it's already exposed, right? After you clean it, it's clamped, right? You connect it, right? After you do that, and then now you can open it up. It's not gonna flow until you start your pump, okay? It just can't flow like that.
Right.
Just as the primary causes flow.
Open, you let this open. Don't close more.
Don't close it. You leave it open. That's
So
it.
now the medication that is running is the primary.
Correct.
So
Because you only have that program.
when you finish with the primary, just start setting the secondary.
Okay, so I'll show you. So now I'm gonna clear the program. So y'all can see it. Okay. I know it looks a bit washed out. I don't know why the pump looks like that, but okay, so we're gonna clear everything out. I'm gonna clear everything start from the beginning. So I'm gonna start as adult, and I'm gonna do a primary line. Let me see if it programs as IV. Okay, IV maintenance. I'm sorry, you guys. I'm like all in the way here. So IV maintenance. Yeah, IV maintenance fluid. That means it's just the primary bag. That's how they call it on this pump. IV maintenance. Okay. So once you do that, you press OK, and it's gonna ask you based on the order in the computer what your doctor's saying. You want normal saline going at what? At what rate? 100 ml per hour, right? So okay, so we'll put that. You manually put in the rate. All right. You press OK. Okay, and it already tells you, okay, is it this
1,000
bag? Is it 1 liter bag?
One
So
minute.
there,
All the information is
it's
there.
already there, and it tells you how long it should take for it to finish. And
10
once
hours.
it's infusing, it tells you as well how much is infused from the time that you hung it. So if you come back in 5 hours, you're gonna see that it says 500 mLs is given already, right? So it should say that, right? Okay. And then now, since now it's primed, it's ready to go, and now we can press start, right? But you want to also program your secondary. How do you program secondary? You see where it says here? Program secondary. Easy. It's all there for you. All right, you press that, and then you want to hang, let me just say vancomycin again, right? That could be a nice piggyback. Antibiotic, right? Okay, so I'll just put the same rate as well. And it's asking you, is it that medication? Yes. All right, and now it's primed. All right, and it gives you the rate and everything there as well. All right, so I'm gonna show you.
Quick question.
Yes.
Which fluid will go into the one closest to the patient?
Nothing.
Nothing?
No. You can use that to do IV push. Like if you have to give like a medication that you push directly into the line, you can do it there.
Okay.
Yeah. But as of now, nothing's gonna be infusing in there. Because you have your secondary connected here.
Professor, but if you push it, right, it's important to kink it above.
To pick it above?
Yeah, for example, like if I'm gonna do IV, like push something, like
You have to clip it?
I have to like kink it, right? That way it doesn't
No,
go back upwards.
you just stop it. You just stop it. Or I know what you're saying. You can clamp it like this, and then you push. I know there's a line, there's air in there, but you clamp it like this so it doesn't go back up the line, etc. Yeah, you can do that. That's okay, because if you don't do that, actually there's meds that can actually go up the line. Okay, and it'll take longer to be infused rather than pushed. Okay, because if it's ordered pushed, it has to be pushed. All right. So yes, clamping is good. that's fine.
Professor, when
Yes.
you have the primary and secondary, they both go at the same time, or one
One
goes
goes
after
after
the
the
other?
other.
In
Right.
secondary, I'll show you. Watch. You will see which one will be dripping. So if I'm gonna press OK, I'm ready to start. Of course, I have to unclamp this because if you don't unclamp it, it's gonna beep and say there's an inclusion. Actually, I'll show you how it does it. And you just press run. I'm able to run secondary. Oh, okay, each. Okay. The secondary should equal secondary. Okay. How does it do that? Okay. Volume to be included. I just say. Okay, run. So this is it. So it's telling you, is it saying air line? Look, downstream occlusion. Because it's saying here, I can't push it because something's occluded down there. And now if I release it, it should pick it up. Unless it's slow. It's slow. It's not picking
It's
it
still
up.
closing the tip too, right?
No. It's open here.
No, but
Because
it's,
downstream
but it's
occlusion.
closed. It's closed from the.
From here?
Yes, it's closed.
No,
Oh,
it's
it's
open.
open.
It's open.
Okay. It should pick it up. I guess the pump is a bit slow, but yeah.
So maybe the pump thinks there's an occlusion because it's not hooked up to somebody and it's not moving the fluid.
No.
Because it's not dripping.
No, it's working.
Now
So
I think it's open.
I think it's working.
Yeah. Because it was close to the tip. So now you'll see what it does. Now it's stopped. Okay. And it's asking you, do you see that the secondary is dripping? And then you say yes, it's dripping. Now there's air in the line. I wanted to show you that. I actually saw the air, but I wanted for you to see how it looks as well. So when there's air in the line, it will tell you that there's air in the line as well too. And you now have to stop it, and I'll show you how. You have to stop it, and then you actually have to prime it again. Okay. So you take it out. Whenever there's air in the line, it's gonna beep again. I know these pumps are horrible. When you become a nurse, you get tired of pumps. Trust me. Silence. Okay. So you just take it out the same way you did. What I'm going to do, I'm going to clamp the secondary. I don't want to waste the secondary. The primary is normally saline. That one I prefer to waste than anything else. You see this large air bubble. I don't know how it happened, but it happened, right? So what we're gonna do, we're still gonna have to go ahead and prime it. And this is you have to unclamp it, okay? And that's it. And you'll see now the primary is gonna go.
So even though sometimes you prime it, let's say for instance the first time
Anytime,
you
yeah.
can't have air bubble.
Sometimes when you prime it, sometimes I don't know if the pump sometimes forms air bubbles sometimes, but you may possibly encounter air bubbles even after you prime, and you don't see air bubbles. That happens a lot. Yeah, I've seen it happen a lot.
So let's say for instance you don't do that, you connect it to the patient, you leave the you can still find air bubbles. Is this a
Yes,
difference?
above the pump, but the pump will beep. It'll tell you there's an air bubble, as you just saw. Yeah. And once you're done, no more air bubbles. You put it back in there, and it's